I'm Ashley Bennett, and I am the Director of Behavior Analytic Services and our Autism Center of Excellence. Behavior Analytic Services is comprised of 5 different programs. The majority of our programs work with individuals that have developmental disabilities and/or an autism spectrum disorder. Within those 5 programs, we have our care coordination team, which is really great at giving families a big giant hug and helping them to identify what services they need, whether that's physical health or behavioral health, and help connect them to community resources and our programs inside of Touchstone and sometimes outside of Touchstone. I really like to call them the quarterbacks for our care. Our Family-Centered Autism Program, or FCAP as it's known, is our counseling program, and our counseling program is individual and family counseling. That specific program works with individuals with autism and their families. So sometimes we work with families only and work on some of the issues that they're having or struggling with when their child receives a diagnosis of autism. And sometimes we're working with the entire family unit, so both the children, siblings, and the parents themselves to help them kind of find their new regular and how to really become a family unit that is solid. Our Language and Learning Center is our comprehensive ABA program. So that program is really designed for individuals who have severe developmental delays and maybe have an autism diagnosis. We teach every type of skill within that program, from learning to speak to learning how to play with peers, learning individual living skills, so can they live independently, whether that's dressing or learning how to orient their backpacks or take community transportation. That program is about 40 hours per week for a child, so it's almost like a full-time job for a child, but what we see is so wonderful, and we see children leaving within about a year to a year and a half that are, for all intents and purposes, able to go to their regular education school or live with the most minimal amount of support. So it's very exciting for our team members at every level to see the success of these children, and the families absolutely love it. Our complex behavior team is our focused ABA program, and the purpose of that program is to work with children who have incredibly intensive behavioral needs. So some of those behaviors might be self-injurious behaviors. They also might be engaging in property destruction or physical aggression with people in their home, people in their schools, people in the community. And the extent of their behavior problems keep them from interacting at school. So we see a lot of children who are either in restricted school placements or they are homeschooled. We also see children who might be going to, if we don't intervene, they're most likely leaving the home, and they are going to be seen in a hospital type of setting where they will be restricted using either physical restraints or maybe chemical restraints. So what that team does is super cool. They go into the home and they work with the family unit, and they identify why the behavior is occurring. And we meet up with our Meet Me Where I Am program, or a WIT program, and we provide an intensive treatment program that wraps the entire family so that child can stay in the home, that family can stay intact, and we move that family closer and closer to living independently as a unit. So as we start seeing success, we're training parents and siblings to be able to support that positive behavior, and then we start to fade out and as the child becomes more independent. We also have our ACE Connections program, which is an independent living skills program and also a parent education program. So often we see that when parents have their child diagnosed with an autism spectrum disorder, there are a lot of questions that they need answered. What is the diagnosis? Where can they get resources? What does their life kind of goals? How do they need to maybe adjust their life goals? What does it mean for their children? How can they show up best for their children? So part of that parent education is really being able to help parents understand the diagnosis and also help connect them to services that might be helpful for them and their families for a short period of time or for a longer period of time. The independent living skills portion of that program works with children who have delays, but maybe not as significant to need ABA services. So we see families who come in for maybe toilet training or how to write a resume and learn some job skills to then be able to go out into the community. All 5 of the programs that I've mentioned in Behavior Analytic Services are part of our Autism Center of Excellence. And what our Autism Center of Excellence is, it's really 3 things. So number 1 is a hub for families who are at risk of or who have a child with an ASD diagnosis. So we help walk them through maybe the diagnostic portion all the way through transitioning to adulthood. The second part of that is we are dedicated to training people on how to work with individuals with autism. So we have done trainings for other providers in our community. We have trained the police department and foster parents. We've also trained fire department staff to learn how to respond to individuals who have very different needs than other children. And then the third portion of our Autism Center of Excellence is really looking at evidence-based practice. So we do a lot of research on what are the best practices that are going to help the symptoms of autism spectrum disorder. And we align our programs and all of our programs around Touchstone with those best practices so that we know that when families come in, they are going to receive not only a hug from our care coordination team that is going to walk them through all of the needs that they have, but they're also going to be able to receive the best care and hopefully relieve some of those symptoms as quickly as possible. We are actively recruiting individuals who are very much like us, who like to have fun, who laugh, who love children, love to work with families, who allow themselves to be wrong, and who allow themselves to discover better ways to help serve their families and also take care of themselves personally. We work very closely as a team, so people that we are looking to join our team are those who are very team-oriented and really looking to become better versions of themselves as clinicians. Please come join our team.